Hey guys, Kyle White here, Doctor of Physical Therapy here with Body Talk. Today we're going to be talking about a herniated disc and exercises that we can do to correct it. So when we talk about a herniated disc, we're basically talking about the soft inner substance of that disc that lies in between the vertebrae coming out and impinging on a nerve root. Now if you look at the nerve roots on this model, if you have a model, if you see in some pictures online, you'll notice a lot of the nerves are cut. Well, in a real human body, they don't actually stop. They are continuous. They form a bundle and then they run down your leg, hip, back of your leg as the sciatic nerve, and then they continue on into your foot. So you may be thinking, everybody keeps telling me I have a herniated disc, not having a ton of pain in my back, but I'm mostly feeling my hip down my leg. Well, that's why. We like to use the analogy of a water hose. If I clamp a water hose at the top toward the spigot, it's not going to let water run to the rest of the water hose. It's going to cut it off. Well, if we are having issues here, that can also cause symptoms on down the chain where that nerve continues on down. We're going to show you how to correct that right away. The first thing we want to do if we have a herniated disc is get out of a gravity force position. So we want to take gravity out of the equation. When we're standing upright or we're sitting, gravity is pushing down on those vertebrae and it's causing increased intradiscal pressure, which is going to cause that soft nucleus pulposus to actually push out more. So what we want to do, we're going to try to get on our stomach, and I actually want you to prop up on your elbows. Now, if you are unable to tolerate this position right off the bat, what you can actually do is take a pillow, put it under your hips, and then come down and maybe lay flat if you can't prop up on your elbows. But if you can, this is the ideal position I want you to be in. The pillow just takes a little bit of that lumbar extension out of the equation. When we're there, a lot of times we have a herniated disc. We haven't gotten into extension a long time because we're kind of favoring to that disc. We're kind of leaning away and leaning forward. We want to get into an extended position as soon as possible, because that's actually going to help that disc resorb back to where it needs to be. Now, to progress that exercise, we're going to go right into our second exercise, which is actually a prone press up. So what we want to do here is push up like we're doing a push up, but we actually want to leave our hips on the mat. And then we'll come back down. All of this is to tolerance. So if you can barely tolerate the prone on elbows, you probably don't want to jump right into the prone press up. I like to be very careful with how I progress a lot of my patients, but if you're able to tolerate this today, I want you to try it today. And I like to do 3 sets of 10 with that. And when you get to the top, you can kind of hang out there, kind of let your hips sag. You can kind of see how the lordotic curve is kind of increased in the lumbar spine there. That's going to also help that disc resorb back into the intradiscal area and take pressure off that nerve root. Now, this may be uncomfortable for a lot of you to start with. Soreness is normal. We're moving in a way we probably haven't moved in a while. As long as we are decreasing the symptoms in our leg, even if the symptoms in our back may increase a little bit, we're getting some more soreness, pain in our low back, but as long as the pain is coming up our leg, we're in the right path. I tell people that a lot of times, well, I don't even have pain in my leg anymore, but my back is really hurting me. It may be that you're just noticing the pain in your back more now that the pain in your leg has kind of come up the chain. So you're on the right track if that is happening. If that is happening for you after doing those 2 exercises, leave a comment for me and let me know. I'd love to know. I'd love to hear how you respond to these exercises. Now we'll get into the third and final exercise. The next exercise we're going to progress to is what we call a supine bridge. A lot of people know it as this right here, but I want to add a little something to that. I want you to actually posterior tilt, so kind of tuck your bottom underneath you and then come up. And that's going to kind of add to that core stability, core control with the exercise. I like to tell a lot of my patients, don't feel like you have to come fully extended on the first rep or the first day. If I can get a tuck and a lift, that's fine. We don't want to push through any pain. We don't want to aggravate this injury any more than it already is. We definitely don't want to increase radicular pain down our leg or down the back of our thigh or even in our hip. So again, you may feel yourself in a kind of an anterior tilt. Let's tuck and then raise our bottom. Then back down slowly. Let's try to do 30 reps of this tuck and bridge. Guys, that's going to be all the exercises I have today for a herniated disc. If you found that helpful, drop me a comment. Let me know what you think. Give me a thumbs up if you liked the video. Herniated disc is a very tough diagnosis to recover from. If you're having pain, if you're having issues, you're trying these exercises, you're not getting any better, it may be time to seek some medical attention. A lot of times we can see a lot of success here in the clinic. I'm not saying that surgery is never warranted. Sometimes it is, and that's just the route we have to take. But a lot of times we can get a lot better if we're consistent and do these exercises 3 to 4 times a day, consistent with our reps, three sets of 10 on each of these, or 30 reps straight, either way you want to do it. Give it a shot. Let me know how it does. We'll see you next time on Body Talk.